Remembering the victims of the movie theater tragedy. We have seen so many touching moments outside the Century 16 Theater. People are coming there to grieve and to honor the victims at the memorial site. One such moment involved a mother and her young son. Aubrey Hart's father's godson was Alex Sullivan. Sullivan's life was cut short, you may recall, at the movie where he was celebrating his birthday. Her son Josiah, just 2.5, seems to sense the weight of this moment, cupping his mother's face as she cries.
This tragedy hopefully will make all of us better people in the end, because we can't let bullies like this take it. All of our good times that we can actually spend as families.
We want to focus more on that now, on helping our families through the tragedy and helping others.
Earlier this week, we focused on how we can heal as adults. We all need that. Now we want to focus on children. And Anya Beebe is a licensed professional counselor and parenting coach, the founder of Whole Hearts Counseling Center. And she's here as out of Denver 7's partnership with Colorado Parents. We appreciate you taking the time. I know you've been very busy. You've helped people of all ages kind of work through this. But let's focus on children today. This is something they need as well.
Absolutely. Absolutely. We as adults are having a really hard time making sense of this terrible situation. And for kids, it's even more challenging. They're likely to experience more and more high levels of anxiety. So I want to offer some parents signs that they can look for.
Okay.
So if your child is obsessing about the details, if they're having a hard time letting go of their worries and fears and really having a lot of distress, and you can tell they're visibly distressed all the time by the situation, that's one sign to look for. Another sign is if your child is excessively asking the what ifs. What if this happens? Every time they go out, you know, a lot of questions, needing constant reassurance and consolence, you know, and they're hard to console. That's something to look for. If your child is having a hard time sleeping, having common nightmares, worries at night, sleeping with the parents when usually they didn't do that before, that's another sign. If your child is having a hard time doing their daily activities, if they're not doing the things that they used to do, that's another sign to look for.
Okay.
Sure.
What about taking our children to the memorial site, as we've seen? I saw that when I was out at the memorial site. Is this a good thing? Is it a good thing for a young child to see parents weeping and so sad about a situation?
It's really healthy for children actually to see their parents express feelings, because that gives them permission to do the same. We want kids to be able to talk about it. Doing things to help, like there was a piece about some girls that were doing a fundraiser. That's wonderful. When we help others, we help ourselves heal. So by reaching out to the community, that's a really great thing. We just want to make sure not to give too many details. We don't want to focus on the violence and the details of what happened, especially with really young children.
So you've given us the signs to look for in our children. What can we do as parents to help them?
Well, the first thing is letting our kids know that we're available to talk. Being there, you know, letting them know, let's talk about this. I can tell you're worried. Some kids kind of shut down, so it confuses parents. A lot of parents have told me, my child isn't talking about it, so I'm not going to say anything, even though I know they know. But we want to make sure to check in. We also want children to be able to express themselves. A lot of times when kids have worries, they might go on and on. We want to validate that we understand what they're going through and really, really listen. Not push it away and say, okay, this is excessive, this is a little too much. We want to make sure to listen to them.
At what point, Anya, would a child need professional assistance? Say mom and dad can't do what this particular child needs. How do you know?
Well, if it really starts interfering with daily life, if kids are really having a hard time doing what they normally do, they don't want to leave the house, they're afraid to separate from their parents, when that wasn't an issue, that's definitely a sign to look for. Clinical anxiety isn't diagnosed for 6 months, but I think really proactive parents can, you know, see when these signs are, you know, showing and can help their kids sooner.
So you may see your child worrying about this. They haven't brought it up. You're going to try to touch on the subject. How do you bring it up? What would you say to them?
Well, you know, a great way to help kids reduce the anxiety with the situation is to start with the end first. Say, I know this has happened, and thank goodness we're all safe now. You know, you're safe. You're going to be fine. This is over. The bad guy is in jail. You know, he's not going to hurt you. Kids need to know that they're safe. So sometimes when we start the conversation in that way with the reassurance first, and then ask them what they know already and what they want to talk about.
And another nice thing is that free counseling is being offered.
Yes.
Tell us about that.
There's lots of wonderful, wonderful organizations in the city that are, you know, doing things to help the victims and even just people that are affected and having anxiety from the situation. So Aurora Mental Health is one. The People House of Denver and Aurora has a wonderful crisis team that's pulled together, and the Denver Therapist Network has over 177 therapists involved, and I think over 50 people have offered free counseling services. So what's really great is the community is really reaching out to help these people and is really focused on healing.
Yeah, you've had a busy week, so
Yes,
I know you must be
very much.
exhausted as well.
Yeah,
So thank you for your service.
Absolutely,
We
thank
appreciate
you.
it. Thanks for coming in today.
Thank you.
And if you need to take another look at that information, we have it on our website. Look for that red button. Just click on that.